Hello, everyone. Welcome to the Working Group Global Equity, Access, and Inclusion. Our working group started together a little over a year ago with the mission with the idea that we would be focusing on reaching the underserved. And our first piece of work was to really define what that meant and to look at what those words meant, how heavy those words really are in the community, and the overlap between our work and so many of the other working groups' work. So we started to narrow our focus, which then really broadened our focus. We narrowed our focus to, and we came up with the name Global Equity, Access, and Inclusion. And then we asked ourselves, well, what does that mean? And what does equity, access, and inclusion mean in the Parkinson's community? Our first task was to collectively define the scope of our work and look at the academic literature as to what health equity really is. And we also did a broad look throughout the world of best practices in other disease states, in other conditions throughout the world, what organizations were looking at approaching health equity, and that's how we defined what we'd be working on. To start, we thought it might be helpful to sort of level set what the definition of health equity is. And so I'm going to provide kind of a high level, more academic definition of health equity. In the field of public health, and to be clear, no one in our working group is an expert in public health. We're all Parkinson's advocates and experts, so we're looking to some of you in the community who are public health experts to help us define this. But as we looked at the literature, we found that there's really a basic understanding that health equity is sort of the basic principle that all people have a right to health. And the differences between incidence and prevalence of health conditions like Parkinson's between groups are commonly referred to as health disparities. And most health disparities affect groups who are marginalized because of socioeconomic status, because of race or ethnicity, perhaps sexual orientation, gender, disability status, where people are located geographically, or a big combination of those factors. And people who in those groups experience worse health and also have less access to healthy food, good housing, education, safe neighborhoods, freedom from discrimination, and that support health. Health disparities are often referred to as health inequities when they are the result of systemic or unjust distribution of these critical conditions. Health equity in public health literature and practice is when everyone has the opportunity to reach their full health potential, and that no one is disadvantaged from achieving this potential because of their social position or socially determined circumstances. So that's the broad definition that we've been working from as a group. Our next step was then to think about, well, how can we as a working group perhaps serve as advisors or consultants to all of the other 5 working groups to ensure equity, access, and inclusion in all of the topics. And that's when our colleague David Leventhal came up with an idea of developing a checklist. I'm going to turn it over to David to talk about that.
Thanks, Polly, for that really thoughtful and comprehensive introduction. And I think you're right. Where we started in our committee was thinking about the hardware of equity. How do we create programs, or how do we distribute equipment? How can we put things out there in the world that will raise the level of equity in the Parkinson's community? What we realized is that we really need to work on the software. We need to work on the code, and we need to embed that code of equity into everything that we do. The checklist idea was not an original idea. It came from a number of readings and an acknowledgement of Atul Gawande's checklist manifesto, in which he talks about the value of creating checklists for highly complex medical procedures that expert professionals do every day, but still need to refer to a guide. And the thought was that by creating a checklist for different constituencies within the WPC family, we would give people a chance to start to knowledgeably and comfortably fit in this equity code into all of your initiatives, into everything that you do. The checklist system is really designed to be a series of questions, a series of prompts that invite committees and organizations in the WPC family to ask those tough questions, to ask who's not at the table, to ask how do we reach and engage with communities that are not currently appearing at our meetings, at our programs, at our meetings, at conferences, and our clinics. And rather than being prescriptive, the checklist is really an open-ended guide. It can be adjusted to different locales, to different communities, different types of organizations. We have created 5 different checklists that I'm going to let Joanne talk a little bit about. But the basic idea here is that these checklists will guide first the leadership committees. Then, based on feedback from that process, we will expand and open out the checklist to be available to anybody in the global Parkinson's community to adapt as they see fit. These checklists will provide guidance on how these committees and your organizations might embed the values of equity, inclusion, and accessibility into every element of your work. Again, rather than being prescriptive, these aim to guide and support processes and ensure that the inclusive values and goals of the WPC are reflected in the questions we ask, the partners we recruit, the connections we make, and the projects we develop. To quote from the Checklist Manifesto by Atul Gawande, quote, "It is common to misconceive how checklists function in complex lines of work. They are not comprehensive how-to guides, whether for building a skyscraper or getting a plane out of trouble. They are quick, simple tools aimed to buttress the skills of expert professionals." That's all of you. "And by remaining swift and usable and resolutely modest, they are saving thousands upon thousands of lives." In our case, we're not in an emergency room or a surgical theater, but we are interested in transforming thousands of lives of people living with Parkinson's, particularly those who right now are not engaging with the educational, clinical, or programmatic opportunities that are available to them. And with that, I'm going to turn it over to Joanne to talk a little bit more about the nitty-gritty of our checklists and bring us into the next part of our presentation.
Thanks, David and Polly, for the introduction. First up, there's a Q&A there. I'd invite everyone to post some questions to us before we move to the breakout rooms. So please do that. We really would like to hear from you, so please do that. So I'm going to introduce the concept of the checklist and our 5 checklists as we have developed at this stage. This is the beginning of the checklist, and they're all very different. So the purpose is to help identify gaps in the knowledge, practice, and establish targeted actions required for Parkinson's health equity programming, and communicating about the equity approach. So the first checklist that we've come up with is organisational capacity. So this is just in a little bit of detail: commitment to advance health equity. What are the funding decisions that you need to make as an organisation to stay equitable? Your skilled and diverse workforce, and what are your product and service offerings to ensure that you're an equitable organisation. The second checklist is community engagement. How do you effectively engage the Parkinson's community? What are your barriers around community engagement? And how can we engage and balance both community and clinical expertise in our outreach efforts? Our third checklist is around partnerships. How can we build diverse and inclusive Parkinson's partnerships? How do we engage with new partners in a meaningful way for the benefit of our community? And what are the challenges in building relationships? Our fourth checklist is around health inequities. What information and processes can we use to identify health inequities? What tools and resources do we need? And how can we engage with our community members in gathering and analysing data? We need data for everything, so that's a really important checklist. And finally, before we move into our breakout rooms, the fifth one is around developing strategy that's equitable. So how do we address health equity goals when developing strategies? How can we address health equity goals when designing these strategies? What tools do we need? And how do we address the goals when we're actually implementing the strategies? So we'll come back and do a brief debrief after that. So
I got to participate in a breakout room. It was just really wonderful conversation. It's so interesting how the work of the Global Equity and Access Group overlaps with just everything. It reminds me of the earlier conversation about destigmatizing Parkinson's and shame. And it was such a great conversation about how do we make sure everybody's at the table. And the fact is, if people don't see themselves and they're not represented, they're not going to feel welcome at the table. But then that ties into the earlier work around destigmatizing Parkinson's and shame. If they feel shame, they're not going to want to have a seat at the table. So what a great conversation. It was led by Isabel and scribed by Joy. Thank you for a good table discussion. I look forward to hearing more from the group as they wrap up what they've learned today. So I'm going to hand the mic back over to, I think, Polly.
The concept of a checklist, I think, was appreciated, and clearly we have much work to do to bring this idea to life. Our group was really looking at ways that larger Parkinson's organizations can support smaller Parkinson's organizations, how larger Parkinson's organizations can help in South America and Africa and Iceland and other places, because larger organizations have the resources, have the expertise, have done a lot of the heavy lifting that smaller organizations are starting to do. We also looked at whether Parkinson's organizations can lean on other humanitarian organizations that are doing the work of health work in communities, and whether we could lean on those organizations and teach them about Parkinson's, and so that Parkinson's education can get spread more widely throughout the world. There was also a comment in our group that, going back to this idea of equity and inclusion, that the language that we all use in our organizations is noble. And this idea of health equity and organizations saying they want to be inclusive is noble, but individuals who don't have access and don't feel included see that language and do not think that they're being represented in that language. So that all of us in the community need to be very, very intentional with our language and careful. And that was one of my big takeaways from the group. Our working group is tasked with consulting and advising all of the other 5 working groups over the next year, 2 years, so that we can infuse this idea of equity, access, and inclusion into everything that we're doing. We'd love help in the working group. We'd love your expertise if you're a public health person or if you are passionate about this topic. We could use that help. And I think from there, I'm going to see if Joanne or David have any other comments that they'd like to add from their working groups.
Thanks, Polly. Really great, lively discussion in our group too. I think our working group has a little bit more to talk about after the discussion around the table. One of the big things that came out was around making sure that the checklists are simple and easy to use. And like a question was posed with us, should it be a checklist or a set of guiding principles? Because sometimes you need a higher level before you delve deeper. Also, we talked about embedding the checklist / principles into the culture of an organisation and into how we do every day, how we work with our community on a daily basis. Also needs to make sure that it's not tokenistic in what we do. And one of the clear messages was great intention with the checklist, but make sure we stop and listen, build relationships before moving forward. So I think that's a really big takeaway for us all. Not one size fits all is another theme to come out of it. And that probably came out in all the groups. You know, we presented 5 different scenarios of possible checklists to work with our community, but we have to remember not one size fits all. And last bit from me before I hand over to David to wrap it all up, but the community will tell us when we're delivering appropriately and equitably to them. And so we've always got to listen to our community. So I'll hand over to David to finish the session.
Thank you, Joanne and Polly. I'm going to touch on things you've already said, and I think our group started talking about this question of who's not at the table with us, but we really started to go down, and in the process of having that conversation, came up with a number of items that could be on anyone's checklist. They're broad and they're really critical. The first was really understanding that there are resources that already exist in many of the communities that we feel are not engaged with our community or of our organization, right? It doesn't mean that there's nothing there. They have developed often their own resources, their own go-to clinics or physicians, their own programming. They may not necessarily be Parkinson's specific, but they are present, and we need to understand and respect that. So it's more about finding partnerships and supporting what's already there and bringing a Parkinson's focus to it, rather than going in and saying, well, we have all the answers and we have this this great program that you should try. The second idea was really how we tell stories, and making sure that in telling those stories, we're really reflecting who's in the community and reflecting a diverse breadth of stories and experiences and images. Somebody mentioned that was a nuanced approach, but we talked about how important it is to be able to see oneself reflected in an organization and in an organization's activities. We had a long conversation about not just talking the talk, but walking the walk, that those of us who work in offices at desks run the risk of being disconnected from the grassroots work of building trust, of being in communities, of showing up at meetings, of really listening and being engaged with communities outside of the office, outside of phone calls and emails, but really being on site. It's been a bit tricky over the past year, to be sure, but as we start to go back to more in-person events, really being present, being available, and working on the street level, not just in the office. I thought that was a really important point as we are aware of equity, diversity, and inclusion being buzzwords and not having to be buzzwords, but really serving as a pillar for our actions. Culturally aware planning. So we talked a lot about language appropriateness and diversity of creating resources in different languages, but also how important it is to make sure that those materials are culturally specific. So the content, not just the words themselves, but how ideas are presented, how initiatives are introduced, are sensitive and aware to the communities that we're trying to partner with and engage with. So language is the first step, but culture is a bigger picture, and it's often a more difficult one to do well, right? Making sure that in the design process, say for example, designing a website or designing a new program, that we are inviting people living with Parkinson's from diverse communities to be part of that process. It goes back to that element of trust, right? So the design process is shared, it is a partnership, and making sure that that design, whether it's a website or a studio or a new initiative or program, includes voices from a broad range of community members. And I think that's it. So I'm going to let Polly wrap it up and turn it back to our hosts.
Thank you all for participating. David, Joanne, for being such great partners in this work. And we look forward to working with all of you over the next year before WPC Barcelona 2022.